According to the World Health Organization's Global TB report, in South Africa, more people are estimated to have died of TB last year than COVID-19. This as the world marks World TB Day under the theme "The Clock is Ticking," which conveys the sense that the world is running out of time to act on global leaders' commitment to end TB. So let's talk about this further. We're joined via Zoom by Dr. Lucy Connell, TV program lead at the health NGO Right to Care. Thank you so much for coming through.
Thank you very much for the opportunity to join the conversation.
To talk about societal alertness to TB and also taking it seriously, are we still really screening for it?
We are screening for it, but what we are doing is not picking up all the people that have TB. And just to let you know, at the beginning of March, the results of the first ever TB prevalence survey were released. And that shows very, very clearly that we are missing TB across the board in every age group. The amount of people we reported in 2018 was far less than the number picked up in the National TB Prevalence Survey for 2018. The bulk of the data collection and the testing for TB happened in 2018 during the survey, and we can see that there's a very big discrepancy between the numbers picked up in the survey and the numbers we report at the end of every year. And so we can clearly see that we are missing many people, we are not diagnosing enough people, and that there are probably some people that we did diagnose that we didn't get onto treatment. And this, of course, is of huge concern because for the individual, not being diagnosed means the development of ill health, possibly death. It means the inability to go about your daily tasks as you would have before as your disease progresses. And we also see that the group most affected by TB in our country actually are in the economically active age group of between 35 and 44 years. So you can see that unavoidably, TB has a massive impact on the economy. And in fact, it is known to be a condition that is a poverty creator. It creates poverty within families, within communities, and ultimately knocks onto poverty within the economy as a whole.
When it comes to taking TB seriously, is it because sometimes there is the error of omission in terms of looking at the exact causes and diagnosis thereof? Because if somebody is approaching the winter season, could be having that touch of flu, they could be sneezing, coughing, becoming restless, and not really considering that it could be TB, but just influenza. And when it comes to also prioritization of debilitating diseases, such as, shall I say, diabetes or even cancer, when it comes to the developing stages, does it mean that we overlook all these diseases, we concentrate on these popular ones like HIV, like COVID-19?
No, we can't. And COVID has taught us that lesson. You cannot take your eye off the ball of all important diseases that make most of our population sick. So, for example, during the hard lockdown phase of COVID, which was absolutely necessary and helped us flatten the curve, the testing rate comparable to the previous year's testing rate at the same time dropped to 50%. And that was a function of two things: people coming to the clinic less readily because they were afraid of getting infected at the clinic. They had to have a very good reason for traveling during hard lockdown. And then in the clinics themselves, the staff were overwhelmed with coming to terms with how to manage COVID. And all the financial, human, and other resources were directed to COVID. But very quickly, the Department of Health noted the drop in the diagnosis of TB, the rate of diagnoses, and realized that we cannot have this happen. If we neglect TB now, we have a harvest of illness and death down the line. If we neglect diabetes now, we will have a harvest of illness and disability down the line. What we've got to do as a health system is manage all these threats and to see how we can integrate our management where it makes sense. So, for example, a lot of the symptoms of TB and COVID overlap. So, for example, the presence of a cough, feeling shortness of breath, getting a fever with chills, night sweats, all of those happen in both TB and HIV. And both health workers and us in the population have to realize that TB is serious. So when we have that, we don't only think of COVID, we think TB. And health workers know that if someone presents to you with those symptoms, they think TB as well, and they do COVID testing and they look for TB. And just to answer your question of don't we take it seriously, the prevalence survey shows that as a population in our country, we don't. So, for example, there were 60% of the people that tested positive for TB in our survey had symptoms and had TB symptoms but hadn't yet gone to the clinic. And about a quarter of those people said, well, yes, we had a cough, we had this, we had that, but we didn't think it was serious. So it shows we don't take it seriously enough. We also know that our systems and our approach to screening and testing in South Africa need to be improved. So, for example, the normal way of finding out if someone has, or screening for TB when you go to a clinic, is to ask someone, do you have any of the 4 main symptoms of TB? Do you have a cough, a fever, night sweats? Have you lost weight, without trying? And if the person says that, we say, right, this is someone we must test for TB. But we now know that someone can come, they will have TB. If you x-rayed the lungs, you would see changes characteristic of TB in the lungs, but they may not yet be sick enough to have any of those symptoms. And so we know we are missing up to 50% of people who've got TB already, but they don't have symptoms. So the government is now considering totally different methods of screening. So, for example, for some members of the population, they won't have to have symptoms in order to get a TB test, because we know those people have a higher risk of getting TB. And the other example is that the government is looking at digital chest X-ray technology and seeing if it can put it at primary healthcare level. So that can be one more thing that we use to see who might have TB, and we test them and we don't miss them.
All right, yeah, I guess you've said a mouthful on that based on questions that I wanted to ask you. But most definitely, I mean, when we drive around, we do see posters and placards of TB awareness programs. So it really clearly answers the question on whether or not have we neglected promoting the awareness about TB. But thank you so much. That will suffice for now. And of course, we thank you so much for taking part in our program.
Thank you very much.
All right, that's Dr. Lucy Connell, who is TB program lead at the Right to Care. We're going to take a break and we'll be back after this.